So welcome to the Community Connect Provider Orientation. My name is Heather Brandt, and I'm with the North Dakota Behavioral Health Division. I'll be the lead administrator for the Community Connect program. So the purpose of today's training is really to give each of you providers an orientation to the program. Hopefully have some time for question and answer. Really, today's orientation session should not be me talking at you. I would like this to be an interactive time. So if there's questions that come up as I'm speaking, if you could raise your hand or put your question in the chat box, we're going to do a good job of monitoring those areas and trying to answer all your questions. If there's something that I'm not able to answer today, I will get back to you as quickly as possible. And so with that, I'm going to go ahead and get started. I'm going to share my screen. So I do have to jump between screens a little bit today. You'll notice some of that, and I apologize for that. That's just how Teams is, so some shortcomings. All right, so Community Connect, my recovery, my story. I want to start out today with doing introductions and making sure that each of you are able to put faces to names and have emails and phone numbers for some of the new team members that we're bringing on to Behavioral Health Division and explain a little bit about their roles. And so, as I said earlier, my name's Heather Brandt. I'm the lead administrator. Many of you have had contact with me prior, some of you haven't. You can be in contact with me if there's any, agreement type issues, training issues, or just really overall behavioral health division questions or answers. Hopefully I can connect you to the right resources there in that regard. I do also in my position oversee our peer support across North Dakota. So if you have a question in that manner, I can also make sure that I get you connected to the right person. And so my email is right there, my phone number. Feel free to reach out anytime. I do enjoy connecting with you all as providers and individuals across North Dakota. The second person I'd like to introduce is Allison Altoff. Allison is our program coordinator. So this position is unique to Community Connect. Allison will be processing all of the referrals, admissions. She'll be part of that documentation review team. She also supervises the case leads. And so Allison, if you want to put your camera on there, say hello.
Hi, everybody. I'm Allison. I'm really excited for February 1st and to get to work with everybody.
I had to mute myself while Allison spoke because she's actually sitting about 2 feet from me right now. And so when she talks, if I talk, it echoes pretty bad. The third person I'd like to introduce to you, and that most of you might already know, but if you haven't met her, her name's Kelly Larson. Kelly is going to be working in Community Connect in a new position as well. These are called case leads. These individuals will have contact with the participants initially. They'll also have contact with program participants ongoing. This will be who you'll get your referrals from. So when you're being notified that you have a new referral, that will come from one of the case leads. All discharge requests, level change requests, some ongoing trainings, just really a point of contact for your concerns or questions regarding clients. So much similarly to like with a probation or parole office. And since this program doesn't have that piece, this will be your point of contact. So Kelly, if you want to turn your camera on and say hello.
Hello, camera's on. Nice to see some familiar faces, and I look forward to working with you guys with Community Connect.
Awesome. Thank you, Kelly.
You're welcome.
The fourth person is Anna Leah Swenson. So Anna Leah is new to Behavioral Health Division, and she will be joining us as a case lead. So Anna Leah, if you want to turn your camera on or say hello.
Hello, everyone.
Awesome. Thanks, Anna Leah. We're so glad to have you on our team. And then there's two administrative positions that we are actually hoping to make positions on by tomorrow. And so those will be some new additions to our team. Our objectives for today during the next 2 hours, which it didn't take 2 hours the first time, but if it takes 2 hours today, I guess it takes 2 hours. It's really to review and understand the differences in the provider agreements, review and understand the website and what's available there to you, review the provider guidance, review the application for eligibility. We're going to do a broad overview of provider documentation. If at any time today or at the end of the training, if you feel that your agency would like a more detailed review, please reach out and one of us will set up a training with you to kind of walk through that documentation with you. Also, something that's new is the provider guidance. The provider guidance, when I start walking through that with you, you'll see that it's very detailed and giving you information on what you need to do to have good documentation. Role clarification, which we just did, and then we'll have a little FAQ time, so a little time for question and answer. Okay, so the Community Connect provider agreement. I just want to highlight that Community Connect requires a new agreement. So there has been some questions that I'm a free through recovery provider. Do I need a new agreement to become a Community Connect provider? The answer is yes. They are separate agreements. A few points to highlight in that agreement are that we will have an online database. So that question has came up a few times. I'm going to go through some of the documentation today, and there's not an online database for you to enter all that documentation into. But our goal is to have an online database to you as a provider by the middle of this year. A few other differences that I just want to highlight is that peer support certifications. And so if you're working with a peer support and hiring them, helping them with obtaining that certification, or if you're contracting for peer support, ensuring that those individuals that you're contracting with are certified. And then care coordination. So this is where there's been a more questions. So if you're currently a care coordinator in Free Through Recovery and you're providing care coordination services, you do not have to have that bachelor's degree or 4 years of experience. We're allowing those individuals to transfer into Community Connect. However, if you as an agency are hiring a new care coordinator and they do not have a 4 year degree or a bachelor's degree in a closely related field to this position's responsibility, it'll be your job to ensure that they have 4 years of experience in that human service setting, providing direct services to individuals. If you ever have a question on that and you're wondering if somebody should be approved or shouldn't be approved, just send me their resume and I'll take a look at it and I'll give you my feedback on that. We're able to have some flexibility there. I know some other providers, though they had a 2 year degree and 2 years of experience and things like that, and we're okay with that. It also talks about completing the care coordination training. So that falls back on us as an agency is we are developing a new care coordination training. That care coordination training is going to be more broad in the sense that it's not going to be specific to only Free Through Recovery. And statewide, we're adding care coordination and Community Connect, Free Through Recovery, and also under the 1915 I plan. So we need to be sure that our care coordination covers all those needed areas and that it's broad in that sense. And so we're tentatively scheduling that for April. But what we have been doing in the meantime is that if you hire a care coordinator or you want to hire a care coordinator to work in Community Connect, you can email their resume to me and we can give you pre-approval to hire them with the understanding that they're going to start in the next, go to the next round of care coordination when that becomes available. There is also another area in this application that we didn't highlight here, but it talks about the background check. And that's requiring that that the agencies have a background check for employees, not that we will provide a background check. So when a care coordinator starts with Free Through Recovery, they have to have a background check to get access to DocStars, and they're approved by the DOCR. In Community Connect, you will not send us information to do that background check. It's your agency's responsibility to facilitate those and have a policy around that, and what your agency decides to approve or not to approve is an agency choice. Is there any questions on that?
Yeah, I guess I was wondering if we're already, working with Free Through Recovery, do we have to get another background check since we'll be with Community Connect, or
That would
we're
be your
already?
agency's choice. I would say no. Yeah, no, that's an agency policy. And so it's not a behavioral health policy. So each agency has to develop their own policies around background checks. And what they're what type of background check they're doing and what type of what they're going to approve and deny. If I was an agency and I was working, and they had already had a background check through, Free Through Recovery and were approved, I'd have to make an agency decision if that would be sufficient or if I would run another background check. Does that make sense?
Heather, can I chime in quickly on that? I don't typically on these, but I
Please,
did just
Dr.
want.
Peterson. Yeah.
Yeah, so I did. My lighting isn't great either here, so I apologize. But I did just want to mention that one of the things we've really worked hard to do in Free Through Recovery is acknowledge that people who have many different things in their background, right, are, qualified to help others. And so just keep in mind as agencies that there might be some things that we approved within Free Through Recovery that might not make sense for this particular population. For example, I know we have some people with sex offenses who, work in the program who don't necessarily have the ability to be around children and things like that. So just as agencies, I would just think about some of those issues and maybe working through some of those different barriers in this setting that we, really didn't pop up in Free Through Recovery because we pretty much focus on adults and really only interact with the adult clients.
Thank you, Dr. Peterson. And if anybody has any, is looking for any feedback or needs help with developing background check policies, there is a lot of available information online. And I also know that if you look on the the Attorney General website in North Dakota, they have a pretty proficient process to help with background checks as well. Okay, so moving on to our website. The website is nearly final. It's still a little bit of a work in process as always. But what I want to do for the next few minutes is I really want to walk you through that website. Where things are located and really just make sure that you're using all those resources that are available there to you. So I'm just going to reshare my screen here. Okay, so here we are at the Community Connect website. The first piece that you're going to be seeing here, and I'm not planning to click on that right now because it'll take me to that, but if you click right here, it is where the application is accessible. So as you can see, this application is eligible to anybody that visits our website. And I'll talk about more of about the application in detail later. So in here, we review individual eligibility. And so just because somebody meets this eligibility, they also have to go through our screening and eligibility determination process. And so it is the role of the Behavioral Health Division to process all of those applications and make a decision on eligibility. But this is really that core criteria. The service lines are the same as Free Through Recovery, include care coordination, peer support, and access to recovery services. We are updating this link here, this find a provider. So in the next day or two, you're going to get an email. Administrators are going to receive an email from Allison with all the information that you sent to us outlined for each of your agencies. And we'll send that to you for final approval. And then that will be linked here by region on the website. The next areas that I really want to highlight is your documentation. And so right over here on the right-hand side of the webpage is case notes, care plan, monthly outcomes, and then the provider agreement and the provider guidance. And then lastly, we are going to be adding a few more marketing materials down here. This is our rack card. So this rack card can be downloaded here at the website and printed. However, if you send this link to a printing company, it won't print properly, it will bleed. So we will have a survey at the end that if your agency wants rack cards, we will mail them to you and print them and send them to you on cardstock so that you will have a good high quality rack card that you can give to individuals who might be interested in Community Connect. And then as soon as our posters are available, we'll notify you as providers that those posters are available and you can order those as well. And then down here, we have kind of a list of our frequently asked questions and answers, and you'll be able to access these all very shortly. Okay, so what I wanted to do next is just spend a little bit of time. I'm going to go through case notes, I'm going to go through care plans, and I'm going to go through monthly outcomes more in depth. But I kind of want to show you what those look like right from here. So if you have ever, lost an email or lost a file or don't know where you saved it, if I was a provider, I would be starting here every month because this is where or every time I meet with somebody for the first time in a month, because this is where our most updated forms will be located. We'll keep these up to date. Hopefully there's not too many changes that need to be made. All of the forms are fillable PDF. So you at any time would start, can start typing in the fillable PDF. In each area, is pretty self-explanatory. So their ID number, which will be sent to you with the referral, the level that the participant received services at during that reporting period, and you'll always want to document the highest level, just like Free Through Recovery, that they received services at during that month, your provider, and your region that you were serving in, the month, the year, care coordinator, peer support. Some questions that have come up is, do I use a new one of these every time I have contact with a participant? No, you have one of these documents for the entire month. So as you can see here, there's different case note sections. So there's 10 of these. So you should use this for your documentation for the duration of the month. If you had to enter over 10 notes, then you could, yes, grab another one. But what we do also reference in the training here is that if you're having a lot of attempted contact with a participant all in one period of time, you can use one note to document that. You would just select your date of contact as the first time that you're attempting contact. You would put in your attempted contact. The contact duration is NA if you're not having contact with the participant, and then you could document all your attempts. So it would be phone call, attempt, no answer, 129:21, texted, no response, and Facebook Messenger. And so you could kind of do that all in one note. And then when you have contact with the participant, though, that should be a new note. So then that would be, okay, February 2nd, we had a face-to-face meeting. Now, I do want to emphasize the use of these drop downs. We added a few more contact types that are currently in DocStars, but we want you to use the correct type of drop down. It does make everybody's job a little bit easier to figure out what's going on with the participant when these are correct. So if it's a phone call, a text, web-based video, incidental contact, we do have a peer support node as well, and a no-show. So peer support note, I want to talk about that a little bit. Peer supports can complete their own case notes. Um, there's no accessibility issues with that. And so if a agency is employing peer supports and care coordinators, the peer supports, depending on how they do file sharing, the peer support could go in there and type their own note. However, if you're an agency that's contracting for peer support, you're going to put the date of their contact in here, peer support, how long they were with the person, and then you could copy and paste the note that they sent you into this documentation. Are there any questions on this case note document?
Yes. In DocStars, we can put two things, like often I'll text and I'll email and I'll phone. So on your little drop downs, are we able to do that with this one?
No, you could just, all you'll need to be able to write is like attempted contact.
Okay.
And then you'll just say, 127:21, sent attempted.
Yeah, I know how to write it. I just didn't know if I needed to do it, because I could do all three in one day just to see if I get some contact on them.
Yeah, that's fine, Candy. Just kind of put it, it'll just have to be one attempted contact,
Okay.
but all in one note. Yep. Good question. Any other questions?
I have one, Heather. under the contact type again to where would we use the difference between treatment staff and care team? Because that's one
Yeah.
I always wonder too, like even on doc stars with care coordination, there's like care coordination team, and then there's also
Mm,
collateral. And I've seen where like I've talked to a PO and they've documented it as a collateral contact, but then I put it in there as care coordination team.
yeah. Yep. So your care team really is a broad term to use that anybody, it's like a term in free through recovery. It's the probation and parole officer, your free through recovery administrator, and yourself. And so, or peer support or care coordinator. So it could really be any of those people. When I'm looking at like treatment staff, I'm thinking of I have a person who's in treatment at West Central Human Service Center and I talk to his addiction counselor.
Okay, thank you.
So, yeah, and you don't even have to split hairs there really, but care team would be more if you're like staffing it with that case lead, attempting to design strategies to engage the participant, something more along those lines, where treatment staff is really more specific to a provider, possibly in the community that's working with that participant. I wanted to
Thank
give
you.
you guys more options here, but not to make it confusing, so that's a good question. Any other questions?
Yeah. I guess I don't know if I missed it or not, but so when we enter these case notes, is it just for every time we contact them, or is it once a month?
Nope. The case notes should be updated after every
Every
contact or
contact. Okay.
attempted contact with the program participant, the same as you're doing currently in Free Through Recovery.
Okay. All
And
right.
if you look here, there's lots of spaces. So it's not designed to be one time.
Okay.
Hmm.
Oh, I see. Okay.
Yep. Goes on and on. Yep. Yes. Those are good questions. Any others? Now, as I continue to walk through this, I'm going to repeat things multiple times, and I still foresee that there's going to be questions. So, case notes are required to be completed each month and sent with your monthly outcomes and care plan documentation. And I'm going to walk through that a little bit more in depth as we continue here, and we'll talk about timelines and reporting periods. But we have an email address that we'll ask you to send all of your documentation to. So I'll walk through a little bit more as we walk through the documentation, how that's going to look and how we would prefer that is sent to us. Anything specific though to case notes? Anything else? Okay, going back here. One thing I didn't mention with this website is I've noticed that it does better in Chrome or Internet Explorer. When I opened it in Microsoft Edge, it wasn't working as well for me. And when I mean it wasn't working as well, the forms, all the features in the forms didn't work. Okay. So here's the care plan. As you can see, they're designed nearly identical to each other with the first choices. The difference here is this is the date you start the plan. So, we ask that you attempt to start that plan with the participant within 10 days of their referral. That's just when it started, right? And then also there's something new here that every month, when you're reviewing this plan, you can update it as it was last updated or reviewed on this date. If you don't have contact with the participant, it's obviously just going to stay the same as the last month that you updated it. Reason for referral. And so in collaboration with our case lead, when they're sending you the referral, and after having contact with that participant, the goal here is to really write down, why this participant was referred to Community Connect. The same as Free Through Recovery here, I want you to work with, in collaboration with that referral to help identify their strengths. And this is just the greatest time to talk about that, because many times those strengths are those things um, that they're going to be relying on to help them accomplish their goals. And then here's where we jump into the goals. And so similarly to how you're doing it currently in Free Through Recovery, it's not much different. So what might a participant's goal sound like that you've been working with? Somebody throw out a goal there for me?
Obtain employment.
Okay, so does the participant say, I need to obtain employment, or do they say, I want to get a job? Or what does that sound like if you're when somebody's talking to you?
So I need to get a job.
I need to get a job. And the date that was created. So we're going to say it was created today. So it's the 27th. Okay. Outcome. So when we're looking at the outcomes, this one is addressing employment financial. Now, when we get down into the action steps, we want to figure out, well, what are you going to need to do to get a job? And so what are some action steps that a person might take to get a job? Anybody?
Job search.
Okay. So let's try to make that more specific. So you're going to job search. When are you going to start job searching and how many jobs do you want to apply for in a week? So I'm going to say to apply for 5 jobs each week, and let's say you're going to start that next week. So on the 1st of February. That's great. Any other action steps? Obviously, there would be some, but here, we really want you to focus on those strategies being, specific, measurable, attainable, relevant. They need to be time bound and going back to their goal. So the goal is to get a job. So each of the action steps should be relevant to that goal of getting a job. Now, you're never going to change this date created. You're maybe going to add new action steps. You're going to be modifying the completion dates. And you also can add comments as are pertinent to those goals and action steps. Okay, Jennifer, you have a question?
So I know in FTR, we might put stuff that we are going to do as the care coordinator as well.
That does not go in there. Nope.
So like myself sending the job listings from job service each week would not go in there.
No, nope.
It's
This is
strictly
a participant's
okay.
goals. Yep. And so like part of your care plan is I would even go so far as to offer to give this to a participant after we worked on it because these are their goals and the things they're working on. If you need to send yourself a reminder on your Outlook calendar, or you can put that in your case notes that you're sending the client the job openings every Friday or something like that. That could be part of that case note when you meet with them, but not part of the care plan. Is there any other questions?
I have one.
Mm-hmm.
It's kind of, it'll piggyback off what Jennifer just said, but in my mind, when I work on a care plan with somebody that has to do with finding a job, I ask them if they don't mind doing a work intake. So I think I would suggest that many times people are more successful in getting a job when they discuss their work intake with their service coordinator. And from that little bit of time they spend on that to develop a resume, whether it need to be revamped or just totally redeveloped based on strengths or timeline of chronological work. So I would suggest ways to make getting that job for them as an action step and see if they, in a person-centered way, want to accept that.
You're right on, Candy. Yep. You're spot on. And that's specific to community options. So, and what community options has, which that's great that you guys are experts in that area. And I totally know I exactly understand what you're saying, and it's spot on. You can help them kind of setting those goals that are going to help them reach that goal in a person-centered way. Yes, thank you, Candy. I think that was Candy. I can't see faces when I'm talking, so if I say the wrong name, I'm sorry. Okay, the last document I want to review, just a little bit of an overview here, is our monthly outcomes document. Again, you'll see it looks familiar, participant name, ID number, the level, kind of gives you little insights everywhere that I put. Please select the highest level of service that the participant received during the reporting period. Providers will be reimbursed at the highest level they provided services at any time during that reporting period. So a little refresher from that levels training. Care coordinator, provider, region, month, year. The outcomes might sound a little different, but not much from Free Through Recovery. So we try to make things align as much as possible. So this one is, it aligns completely with Free Through Recovery. So the care coordinator is going to go ahead here and select the outcome. Now, these outcomes should be done by the care coordinator. They can be done in conjunction with a peer support specialist, but the documentation, this ultimately falls back on the job of the care coordinator. So yes, no, or NA. So NA would be selected if you had not engaged with that participant as required in level guidance. Please select NA. So if there was like, see if you were having diligence, you were trying to reach that person every week and you weren't able to, you can't answer outcomes. So those are NA. You could put a note here, whatever was pertinent to that situation. Okay, and then when you complete all your outcomes, this document's going to be sent to us, and this is going to be that reconciliation document. So this is not for you to fill out. This is for your administrator to fill out. The second outcome sounds like recovery social supports. So as it walks through it with you here, a participant will get credit for this outcome if they meet at least one of the following. So they're engaged with or taking steps to engage their support network. They're engaged in strategies to avoid more serious problematic substance use, those harm reduction strategies. They're refraining from using non-prescribed mood altering substances, or they're demonstrating an effort to improve their mental health functioning and or reporting a decrease in symptoms. The third outcome is employment financial. We added a few more options here for this one, really looking at, are they employed, job hunting, or do their economic resources meet their basic needs? Maybe they're enrolled in school or workforce training, they're approved and is receiving disability, or they're enrolled in a treatment program that does not allow them to work or earn an income. You'll answer that as yes. And then criminal justice involvement. We will get individuals on Community Connect who are on probation or parole. If that participant is on state or federal probation or parole, they've had no violations resulting in revocation, or the participant has not been arrested for a new offense or incarcerated. They'll answer if you can answer yes. And then this bottom piece here of the document will be saved to be used by the administrator. So this is where they'll help determine payment, any notes if needed, and then payment to provider, which will be added to the payment sheet and sent back to you. It is an okay time to bring this up. I'll bring it up again. Once we send those payment sheets to you, if some of you have been with Free Through Recovery for a long time, you might remember this, but at the beginning of Free Through Recovery, we also had the outcomes on the payment sheet. So that we can save time and we don't need to email this outcome document back to every provider for every participant. Those outcomes are also listed on the payment sheet. So you can compare them to yours if you want to. And if you really want this document back, you can request it from us. Okay. So one of the more important things that I find on this website as well is this guidance. So if you have a question on something, I would encourage you to read our provider guidance. So I'm just going to click it open here. If I had a new employee starting, or if I was going to be a provider in Community Connect, I would read through this and I would become familiar with this document. This document is going to contain a lot of answers to most of your common questions. And also, we worked collaboratively with Free Through Recovery to build this guidance. So our provider guidances are nearly identical. We want these programs, they're sister programs, they're running together. Our service lines are the same. And so we want you as providers to not have to do one thing in one program and another thing in another program. We want them to be, we want that to the philosophies and how we do things to match. So I'm not going to read everything to you in this. You'll have time, you can review this as you see fit. We've talked a little bit about this and then, moving our intervention needle a little bit further up in Community Connect. So, Individuals have those symptoms, they have that behavioral health diagnosis, and often there's that start of those negative impacts, whether it be on their ability to obtain or maintain housing, their finances, their jobs, their parenting, the criminal becoming involved in the criminal justice system. But so often, many of our interventions don't occur until crisis. So somebody becomes incarcerated or loses custody of their children, or ends up in a detox facility. And we're just hoping that we can continue to move that intervention a little bit further up before those crises occur. And that doesn't mean that we won't serve people that have reached that level of crises either. Okay, so services again, the same. Our principles, our values. Just talking a little bit about the program and overview of it. It's the participant, that person that would referred them, the BHD, the provider, and any other systems. So networking and collaboration are key components of Community Connect and Free Through Recovery. And really that care coordinator and that team working with them at that agency are that glue that connects people together, that links them to those needed resources in the community that individuals desire or want to get well. We'll talk more about the application, so I'm not going to go in depth with that, but I just want you guys to see everything that's here. Like let's say you had a question on completing a case note. You can come right to the case notes section. It tells you what are case notes, what are the expectations, what are the deadlines, some topics to include in your case notes, and then it goes and walks through every single section of that case note and what should be included there. Something I'd like to highlight is we will not accept handwritten documentation. So do not print and write and send that documentation to us. We will not accept it. It has to be saved and emailed to us as a PDF. Okay, so I am not going to walk through any more of this with you guys. I'll give you the time to do that on your own. Is there any questions on that? All right. And then again, if you're looking for marketing materials, like I said, I will link that survey that we can mail you marketing materials. Otherwise, you can always click here and print from your office printer. So I'm just going to go back to my PowerPoint. Do I have any other questions so far? No? Okay. Candy, you have a question? No? Okay. All right. So I think I've gotten the most questions so far from providers and Free Through Recovery about the application for eligibility. So I just want to walk through an application with each of you, walk through the questions, and kind of answer any questions that you might have right away. So all applications should be submitted via an online link. That link is available on our website. If for some reason that person or you cannot access the application, we can send you a paper copy of the application as well. That is available. Here is the link to the application. There's also a QR code, I believe those are called. You can take a photo of that with your phone. It'll take you right to the application. So you could literally share that, text that QR code, or send somebody a link and a text message to the application, and it'll take them right there. So I'm just going to open the application and then reshare my screen so we can be there together. I think that worked right. Just a moment. There it is in all its beautiful glory. So application for eligibility. So I will walk through these mock application with you now. Obviously, the first part of the application is quite self-explanatory. A social security number is always voluntary, so a person does not have to disclose that. An address, they're homeless, that question is asked later on. So if they have a mailing address they're using or a shelter's address that they're using, you can put that here. Okay. Just trying to quick get this filled out here. Okay, so number 10, I would like to talk to you about that. So this asks if you would like to have an alternate person that we could contact or leave you a message with, please check this box and include this person's contact info below. If I select no, there won't be anything to put here, but if I select yes, and I'm helping a participant with this an applicant with this application, I'm going to put my name down here. Because if we have any trouble contacting this person, we then can reach out to this alternate contact name in an attempt to engage with that person to let them know the status of their application. Okay, demographics. Many of these are optional, some of them aren't. Can select more than one on almost all of them. Again, if they select they're not an enrolled tribal member, doesn't ask them about anything that tribe that they're enrolled in, but if they say yes, they should specify their tribe. I'm just going to click through these. Same with healthcare coverage. Okay, so we're into the eligibility criteria now, and so what it asks, this question, try not overthinking it, but if you're the parent or primary caregiver for any child or children in your household under the age of 22, what we did to try to make this easier for people is we gave them scenarios because we know that this life comes in every shade of gray and it's not black and white. And so we tried to give them all these scenarios to help them answer these questions. And we also gave them an option for unsure. So, like, I currently don't have custody of my children, but I'm taking steps to gain custody of my children. This qualifies as yes. I'm living in that transitional facility or shelter. I can't have my children there. However, once I have housing, my children will return to live with me. This qualifies as yes. Or I'm working towards reunification with my children, will have custody or shared custody with another parent or caregiver. That's a yes. So once they select yes, we ask them how many kiddos they have. And then we ask, are you pregnant? Yes, no, NA. Pretty self-explanatory. If they're pregnant, their due date. There's a lot of questions around their housing situation. So if they're currently homeless, they don't have to ask it. We don't ask them any more questions. But if they say they're not currently homeless, we ask them, are you currently living in a transitional facility or shelter or halfway house? If they say no, we ask them, are you at risk of becoming homeless? So what we're trying to target there is that group of people who have really that housing is not stable. We also want to make sure that they can get their needs met through this program. So if they say yes, we ask them to please describe that current situation. Okay. The next question talks about being diagnosed with any behavioral health conditions. Now, this is self-report. We don't ask for collateral information. So whatever they're comfortable with reporting. I should also mention that there's a lot of disclaimers in this application, but we only use the information shared in this application to determine eligibility. So I know it can be very hard for some people to answer questions honestly, especially if it's going to a state agency. They might be worrying about that. But these questions are only used to determine eligibility and connect them to the right resources. Pretty self-explanatory. Have you been to an ER detox center in the past 6 months? Are you currently injecting illicit drugs via IV? This question, are you currently or actively working with Child Protective Services through a local human service zone or tribal social service office? Again, we give them that space for unsure because some people just aren't really necessarily sure, but most people know if they have an open CPS case. This is where we start to get into different impacts as well. So how is your substance use or mental health condition currently impacting your ability to maintain or obtain a place to live? So housing. And then again, giving them a lot of different examples. If they answer yes, we ask them to please specify the severity, and then we ask them to describe it. So tell us what's happening to you, what's going on, basically. And all of the rest of the questions for eligibility are that same way. So again, is substance use or mental health condition impacting your ability to secure employment or maintain financial stability? If they say no, we don't ask about severity. If they say yes, we ask about severity. Physical health concerns. Parents, so we ask here about their substance use or mental health impacting their ability to parent. So giving some really broad definitions of what it means to parent, attending their conferences or events, or if they've become incarcerated and they're not able to parent, or if they aren't able to provide their shelter, food, or clothing for their children. And then this one is really trying to just be that catch-all as well. So looking at how their community connections, how their family relationships, how their social relationships have been impacted by those behavioral health conditions, or anything else that we haven't already described above. So like, is there something else that we didn't describe that your condition is really impacting? They can answer that here. Okay, so this is where they enter their signature, but there's a few more pieces where we keep going here, so I don't want to. Okay, so the next piece asks them, as a participant in Community Connect, you have the opportunity to select your own provider. If you would like more information regarding the provider, please visit, and they can click there. And then it asks, would you like to select your provider? If you're unsure, please select no. And then if they select no, we reach out to them and help them select a provider. But we're going to select yes. They're going to say, I've got this provider picked out, or you're helping them fill out the application and they want to work with you. The first thing they do is select their region of residency. And we do have a map that we're linking under selection of provider to kind of help them, because I know I don't have the regions memorized myself. Sometimes I forget certain ones, but we have a map, just like the human service centers use, that will show them where their city is and what region that is. So let's go ahead and pick region 1, Williston. So then it links them to region 1. So you've selected region 1 in Williston. Please select a provider. So let's say they go with, these aren't updated yet. We'll finalizing these on Friday once all that's in place. So let's say they go with All of Us in Recovery. Then it says, as a participant in Community Connect, I understand my treatment and recovery support services will be coordinated through the North Dakota Department of Human Services. I authorize the North Dakota Department of Human Services Behavioral Health Division, and fortunately it doesn't autofill. I wish it did, but All of Us in Recovery to mutually exchange the following information. This is all of their release of information. They type their name here as attesting that that is their electronic signature and put the date in. And that application has been submitted. And so in general terms of process flow, we're asking providers and applicants to, allow up to 7 days for processing and determination of eligibility into the program. As always, we're going to try to attempt to do those as quickly as we can and daily to ensure timely processing. But if you've submitted an application for eligibility with a participant and they haven't heard anything and you haven't heard anything and it's been over 7 days, you can reach out to any one of us, but technically that falls under Allison's job role with the Behavioral Health Division. Okay. Was there any questions that came out of that? Okay, we're gonna go back
I
to
have
the
one
PowerPoint.
real quick, Heather.
Oh yeah, go ahead.
Is there like a certain number of times someone is allowed to fill out the applications in like a given amount of time? Say they fill it out and they were deemed not eligible for it, and then they want to try again in a month or something, or
We
is there
don't
any
have
limits?
we haven't wrote any internal guidance or policies in that, no. So that is part on our FAQ as well, that if a person was denied and they want to reapply, like if a circumstance changed or something like that, that's fine. Part of our review with them too in orientation when they're accepted into the program is that we reach out to them and we review their application for eligibility and just making sure that we have correct data on there um, as well. And so yeah, if you have somebody you're working with and they've submitted multiple applications and they're being denied, it would probably warrant a call to figure out why. And if they've selected you as a provider, we are able to talk to you, and let you know that this was the reason why. Notification of acceptance, though, is going to go to the applicant initially. Where we're gonna call the applicant, reach out to them, let them know that they were accepted, give them a little brief orientation, reviewing the program, and then we're going to send you as a provider that referral information. So we'll talk a little bit more about that whole process here as well. Anything else on the application? Okay, and so at the end of today as well, I'm going to send you this PowerPoint, so you'll have that for your records as well. Okay, so here's what we were just talking about. So once accepted, the BHD case lead reaches out to that applicant to notify them of their acceptance or denial. If a participant or an applicant is denied, it is our goal to connect them to those appropriate additional resources in the community. There might also be additional information that they might tell us if they were denied that maybe they didn't put it in the application that we could also then reconsider eligibility. Then once we talk to that participant, the provider is notified by the case lead that they have a new referral. We'll walk through what that's going to look like. If we cannot reach the applicant and they've chosen a provider, we're going to go ahead and send that referral to you anyways so that you can attempt to engage with that participant. We're not going to hold on to a referral just because we can't reach them. We're gonna pass it on to you as a provider so that you can start your attempts at engagement with that applicant. However, there's another scenario here. If somebody submits an application and they haven't selected a provider, those case leads are going to attempt to contact that applicant for up to 30 days to try to have them select a provider. And if after 30 days we can't reach them, then their application will be closed. Okay, so we've talked a lot about you receiving the referral information. Here's a little snapshot of what you're going to receive from that case lead. You'll receive notification with the date of that referral, their name, their ID, all the information you need to be able to reach them. Also, any pertinent comments that you might find useful that that case lead has gathered during that orientation session. Say, for example, a person is currently active with, Child Protective Services at the zone. And they tell us that, or they've offered that. We could very well indicate that here in comments as something that would be useful information for you as a provider, or. I heard my slide is stuck here. Hold on.
It might just be on my end, but
Okay, can you guys see the slide that says referral information? No?
I can't.
Okay.
No.
Well, sorry. I'm just talking away, no care in the world. You guys don't even know what I'm talking about. Okay. Try that again. How about now? Can you guys start to see the PowerPoint?
Yes.
Awesome. Can you see referral information? Okay, great.
Got it. Yep.
So here is that snapshot I just referenced. Thank you. And what you're also going to get on here is that critical information on who your case lead is through BHD. And so if I was keeping like a roster of my participants, it would be, their name, their ID, the date of their referral, their level, and who their case lead is. And then, all that useful information, because that case lead is really going to be your point of contact for a lot of your needs for your participants. And it might be Kelly and it might be Analia, and the way that that's structured and how we're deciding that might change 6 months from now with how it is at the beginning, but we can't keep it exclusive to providers. Currently, it's just like a probation officer. Not everybody's going to have the same one. Some of them might have the same one. It's just how it's going to operate to start. Okay. Timelines. So the reporting period for Community Connect is the month. And so I know when I started as a free through recovery provider, the most confusing thing to me was the 21st to the 20th. So when you're working in Community Connect, it's the first through the end of the month. It's the entire month. Your documentation can be submitted to us through comconnect@nd.gov anytime from the 1st to the 5th of every month. And so um, all your documentation includes your case notes, your care plan, and your monthly outcomes. And it must be sent by the 5th to receive reimbursement. I did make a note here to try to send in one email with folder attachments for participants if possible, instead of sending, one email for every single um, case notes, care plan, outcome. If you could try to keep those as concise as possible, we would appreciate that. And then we will do the reconciling and review, and then we will send your payment sheets to you for verification along with those outcomes. Just the same as it functions currently in Free Through Recovery, other than we don't have an online database to launch, but we will be working on that. Is there any questions on that? So our first month of services will be from February 1st through the 28th. Your outcomes, case notes, and care plan should be sent to the administrator by the 5th of the month, but to comconnect@nd.gov. Please don't send documentation to, say, my email or to Kelly's email. Send it to comconnect@nd.gov. I'm not going to spend too much time walking through this because we already did earlier, just talking about case notes, type of contacts. I mentioned peer support. So peer support's able to type their own notes. Each agency will need to determine policy and guidelines around this. It's not for us to tell you. Care plan. We've walked through this. So care plan should be started within 10 days of that program referral date. And I always talk about started because care plan is really a work in progress often. Something that you can review very regularly, periodically, but I would be doing that at least once a month where we're looking and we're updating and we're talking about accomplishments or we're changing strategies in certain areas or whatever that might be. Really, the care plan is the responsibility of that care coordinator, but it should be developed with input, of course, from the participant, number one, peer support, and other team members. Gap funding. So gap funding within Free Through Recovery and Community Connect are nearly the same. All guidance is the same. You can submit your gap funding reimbursements by the 15th of the following month, just the same as you currently do in Free Through Recovery. We wanted to keep everything flowing that same way. We did add one additional category in Community Connect titled Family, and it's $100 per 12-month period as the others are. But family expenses might include school or childcare related expenses for children or dependents, a car seat, diapers, wet wipes, crib child's bed, child's clothes, and or shoes. Monthly outcomes, again, we already went through this, so I'm just repeating things because I know the more I repeat it, the more it sticks for most people if you're like me. Again, they include housing, employment, financial, recovery, social supports, and criminal justice, and must be sent by the end of the day on the 5th with case notes and care plan. We cannot reconcile your outcomes if we don't receive your case notes and care plan. If you sent me monthly outcomes with no supporting documentation, I can't reconcile. So that provider would not be eligible for reimbursement. Okay, and then a little snippet of the payment sheet. Doesn't look much different than what you currently get in Free Through Recovery, other than we added drop downs for the outcomes. I've also, since this slide, added an outcome for peer support as well. So is peer support engaged, yes or no? Levels request. I don't foresee too many of these to get started with, of course, but we'll kind of cross that bridge when they get there. But as always, level requests should be staffed with staffed. I put with the participant, so it should be a discussion. You don't have to say, "Oh, I want to change you in levels," but you can say something like, We've been meeting every, now for the last 4 months. You've requested that we meet once a month. If that's something you want to continue with, I don't have to offer you every week then, and we can, maintain contact in person once a month. And then if you need anything further, you can reach out and just, working with them to determine what they need. Transfers or discharges, I don't foresee these right away either. You don't see that linked right now in provider documentation on the website, but it will be. This is the paperwork that you use if you want to discharge or transfer providers. So if you have a client that needs to transfer from one provider to another, you can fill this out, and then that case lead will help coordinate getting that new release of information between the new provider and the participant. Provider capacity. I have gotten a lot of questions on provider capacity and numbers and how that works in Community Connect. We don't have a set capacity number for each care coordinator. What we're looking at is to ensure that the provider is meeting the appropriate level of service for the participants on their caseload. So if a provider has a lot of ineligibles every month, um, that's going to warrant a discussion on capacity and pausing referrals. Because the reason why we had to change how our capacity works is that each provider is going to have different people on different levels. And so one care coordinator might have 30 people, and of those 30 people, you know, 10 of them are on level 2 or level 1, and only, 20 of them are on level 3. So that, and that's their only job. Whereas in some agencies, people are doing care coordination and they're having other duties and their caseloads are a little bit smaller, and that's okay. Or, you have 25 people all on level 3 and you're at capacity. And so when your agency has reached, we're like, I'm not able to take any new referrals, please notify us at comconnect@nd.gov, and we can put a pause on your referrals until you indicate that you're ready to start again. Is there any questions on that? Okay. So just some commonly asked questions and answers. Should I have a client that's on free through recovery and off supervision apply for Community Connect? The easy answer is no. If they're served on free through recovery, there's no reason to have them apply for Community Connect. If there are specific cases, we have been identifying them in collaboration with the DOCR, and we'll be in contact with either that provider or those participants if we're looking at transferring some, not transferring, but having some individuals apply for Community Connect. Most of that's looking like individuals with those very low LSIR scores, with a lot of those risk areas that look more like Community Connect, than free through recovery. Lisa, is there anything you want to add there? When can individuals apply for Community Connect? So we will start accepting applications on February 1st. So if an application is submitted before then, it's not going to be accepted. So please don't fill out an application with anybody before the 1st. Can an individual on federal supervision apply for Community Connect? Yes. If they meet the eligibility criteria, we will accept the application and determine eligibility. Can I submit my provider paperwork via mail or fax? No. We will only accept typed and saved PDFs. Do not print documents and handwrite. These will be returned and not accepted. Was my provider agreement approved? So we've been working on those diligently this week. On Friday, we will notify all the providers that they're of the ones that have been approved and their agreements are final, and that will be linked on our website. Some of you, we might be waiting on just a few additional insurance informations or things like that, but that should move pretty quickly once we get that. And then care coordination training, I did touch briefly on this with you. It's a pretty big project that we're launching. We scheduled it for April, really in hopes that we could also do some in-person trainings across the state of North Dakota that would meet the needs of all organizations. And so right now, tentatively, I've that scheduled for the 19th, 20th, and 21st of April. As more information comes, you guys will be the first to know, and we'll get that shared. And I just want to extend an apology for any delays in that. COVID has kind of changed how we do things, and I wouldn't get excited about launching a brand new training virtually with potentially 45 to 60 people. So if we have to, we will, though. But we're just working through a lot of things with that right now. Is there any other questions that you guys have?
I know you covered it at the beginning, but did you say those of us that were already care coordinators, we would not have to do April, correct? It's
Correct.
Just, okay.
Yep. So some agencies have said, like, well, what if we want to? Well, if you want to, that's fine. But if you already have, then you're not required.
Heather, there's a question in the chat from Jennifer P. Do we have to take the training over again?
Nope. If you already took care coordination for free through recovery, you do not have to take the care coordination training again. Anybody else? No? Well, if I don't have any more questions, I'm going to go ahead and end our training for today. In conclusion, I will send all the registered attendees the PowerPoint presentations today and all the documents that I referenced that are also on the website with a link to the website. And then in addition, Analia, can you put that survey for the marketing materials, and then I'll send that in an email as well. So there's going to be a survey link in the chat here that you'll have saved, and then I'll also send it again in a email. So if you want any marketing materials, please fill that out and we can send you those marketing materials. Don't send that link to a printing shop because it won't work right. You can print it to your desk printer and it's good, but the printing shop, they told me it will like bleed. All right. Well, thank you for your time, and we're really looking forward to our launch on the 1st. Please reach out with any questions, and we'll be in contact with you all soon.